Hello, everybody. This is again Professor Jaykar Thomas from Chennai Medical College. In this particular video, I'm going to talk more on eczemas and contact dermatitis. Now, once you realize that eczema is formed by the word ek plus zy, which means to boil out, and there can be different forms of eczemas, endogenous eczemas and exogenous eczemas. To put it in simple terms, eczemas that can come from inside the body to eczemas that can be acquired from outside the body. Now, let's concentrate on those which come from outside the body. Now, from outside the body, what we get is mostly the contact dermatitis, which again can be divided into two forms, primary irritant dermatitis and allergic contact dermatitis. The primary irritant dermatitis is a non-immunological phenomenon, whereas an allergic contact dermatitis is an immunological phenomenon. Why I tell you this is primary irritant dermatitis occurs once and need not be repeated, whereas allergic contact dermatitis gets repeated so frequently every time an individual is exposed to this particular antigen of foreign body. For example, ladies who are using the kumkum, also known as the reddish spot that they use, the vermilion is called, the vermilion chemically. Now they start developing an allergic contact dermatitis, and every time they use this, either the vermilion or even the oleash taken from tepals, they develop an eczema or dermatitis. Now these are the people we have to be advising them correctly. And if you look at it morphologically or clinically, three forms: acute, subacute, and chronic. Initially, when it starts off, it might be a oozing lesion. That's what we call as an acute eczema. Those eczemas which are just moist to touch, we call a subacute eczemas. And those eczemas which have become chronic, dry, scaly, we call them as chronic eczema. And the need to differentiate these three forms is, in the case of oozing or acute eczemas, we use lotions. In the case of subacute eczemas, we use creams. In the case of chronic eczema, we want to use an ointment. Now, that is a little bit of definition and the types of eczemas and all that we know about the rest of it. But how are we going to really address the patient? How are we going to address the patient? That becomes important. We have to definitely and clearly tell them the offending agent. That is very, very difficult. It's not an easy thing. It's easily told, but not easily done. Detect the offending agent. Having detected the offending agent, advise the individual to keep away from the offending agent. And if at all by accident or by profession, they have to get in touch with them, always continue the treatment for a longer period, because eczemas can be really, really chronic, can be really, really troublesome. Otherwise, there's no special precautions that could be taken, because sometimes eczemas can get what we call as generalized or systematized or hypersensitized. So there are different words that we use for it, but they are technical terminology where the patient's entire body will get eczematized. So this is what one has to be careful about. And having said this, I hope I've covered at least a few points in the management and detection of eczemas. Thank you.
For more such videos, visit or log into dermavidya.com.